On a warm summer evening, the police were called by tenants of a large apartment building. They reported a strange odor and loud dog barking coming from the apartment of an elderly woman for several days. The letterbox was overflowing, and ringing and knocking on the door elicited no response. When the police forced open the apartment door, they found the heavily decayed body of the suspected inhabitant, with parts of her face and hands missing. They also found a malnourished, but alive, French bulldog in the apartment. What happened here? Was it murder? An accident? A fatal animal attack? That's what we are going to find out today in Forensic Archives. It's a macabre thought that our beloved pets might eat us if we suddenly die. However, it's not uncommon for forensic pathologists to see such cases. These cases usually involve sudden, unexpected deaths or suicides. Often, the deceased were socially isolated prior to their deaths, leading to a delay in discovering the body. Typical causes of sudden natural deaths are heart attacks, strokes, and complications from drug or alcohol abuse. When a body with suspected scavenging wounds is found, the forensic pathologist is faced with complex questions. Was it murder? Suicide? A fatal animal attack? Or a natural death with animal scavenging? But first, let's examine the behavior of different animals. Dogs are the most common pets to scavenge human remains. Dogs tend to focus on the face, hands, genitals, and other exposed, soft tissue areas. They often tear off smaller bones, like from the fingers or the toes, and chew on larger muscles. In extreme cases, complete beheading can occur. Numerous studies have investigated dog scavenging. A 2015 study from France compared scavenging patterns in outdoor settings with indoor settings. It showed that wild animals usually focus on the abdomen and chest cavities, aiming to access nutrient-rich internal organs like the liver and lungs, while indoor pets almost always scavenge the face of their owner, avoiding internal organs. An interesting theory that was proposed is that dogs don't actually want to feed. They're trying to wake up their owner, which then escalates into biting. This is supported by the fact that in many cases, dogs started scavenging within 24 hours of the owner's death, even when other food sources were available. In one instance, for example, witnesses reported seeing the victim's red setter bite and lick her face while she was unconscious from alcohol abuse. The dog was likely accustomed to reviving or stimulating its owner in this manner. Cats are usually more hesitant to scavenge compared to other pets. They tend to start scavenging later than dogs and typically focus on the soft tissue of the face and hands. Rodents are the fourth most popular pet category in the US and Britain, but there are not many reported cases of rodents scavenging human remains, likely because they're usually kept in cages or outdoors. However, there is a reported case from Germany where a hamster scavenged the face of its deceased owner. Rats, on the other hand, are more prone to human scavenging if they have the opportunity. Rats are known to attack unconscious or paralyzed people, even infants in their cribs. When a corpse is found with suspected signs of animal scavenging, the body is usually taken to the medical examiner's office for an autopsy. Common questions include, why did the person die? Was the deceased attacked by an animal and killed? Or was the deceased murdered by a human, and the animal obscured the wounds by scavenging? How can the deceased be identified? For this, it's crucial to determine whether skin wounds were inflicted post-mortem, after death, or ante-mortem, before death. This can be done by looking for so-called vital reactions. If a person was alive when they suffered the injuries, the heart would still be beating, resulting in bleeding, and eventually, an inflammatory reaction in the surrounding tissue. This is visible as a red tinge or swelling around the wound edge. A post-mortem wound is a clean cut with no such signs. A vital inflammatory reaction of the tissue can also be proven histologically, so under the microscope, as early as 10 minutes after infliction. Wound morphology is an important aspect of forensic workup. Pet teeth leave specific, recognizable wound patterns in soft tissue and bones. The characteristic hole and tear effect results from the stabbing action of a dog's fang tooth, which serves as an anchor point, followed by head shaking that causes stretching and tearing defects. Often, wounds are licked, giving them a very bright and polished appearance. Rodent or cat wounds are usually finer and smoother. There are discernible differences between wounds caused by, for example, a knife by a human, and those caused by animal bites. Defensive injuries are signs of a struggle. A conscious person attacked by an animal or human will defend themselves, leading to abrasions, scratches, and bruises in defensive body areas like the extensor side of the arms, chest, or hands. Broken bones in the upper body or head area are also indicative of a struggle. In the end, it's important to view the case as a whole. Does the information provided by the police match the autopsy results? What were the conditions like in the apartment? Were there signs of a break-in? Together with law enforcement, it's usually possible to reconstruct exactly what happened. A complete drug screening and genetic identification of the deceased help complete the process. Now, you're probably wondering what happens to the animals themselves. If they're still alive, they are taken to an animal shelter. If the animal has passed away, veterinarians can perform a necropsy, an autopsy for animals. Finding human tissue in the animal's digestive tract is definitive proof of animal scavenging. So, will your pet eat you when you die? It depends. People with a stable social circle and good health care are likely to avoid this fate. However, there are many people in our society who fall off the grid due to drugs, mental health issues, or old age. These individuals often die silently in their homes, unnoticed by neighbors even while alive. Sadly, they might become unintended food for their last companions in life. It's a stark reminder of the importance of community and connection in our lives, and how isolation can lead to tragic and often misunderstood outcomes.